Hello and welcome to Safe Geriatrics. Today I'm going to talk about a class of pain medication known as NSAIDs. NSAIDs help to reduce pain, inflammation, and fever. Some people alternate NSAIDs with acetaminophen. Acetaminophen like paracetamol, but they are not the same thing. Examples of NSAIDs include ibuprofen, aspirin, naproxen, diclofenac. I know a lot of people are familiar with this because it's a strong pain medication. And some of the things people manage with these medications are headaches, muscle pain, arthritis, back pain, menstrual cramps, inflammatory conditions, and fever. Sometimes after surgery, a lot of people after surgery, they use pain medication, especially diclofenac. And this is the thing, when you're taking diclofenac or some of these NSAIDs, they have the possibilities of causing you GI bleeding. This is what happens. Sometimes maybe you don't have ulcer or you have not experienced ulcer before, but you're taking this kind of medication. So when you're taking this kind of medications, you might have stomach irritation. And sometimes when you eat, you begin to feel pain in your stomach. That is because of this medication. And sometimes when you go to the bathroom, your feces will no longer be the usual color. It's going to be a little dark. And that's because you are having upper GI bleeding. And at this point, if you're taking this medication, you have to see your doctor and explain to them, this is what I'm experiencing. I don't usually experience this, and make sure that they can either step it down, give you something that is not an NSAID but can manage pain. And some of the things that are not NSAID but can manage pain, like acetaminophen, I said, paracetamol. Some people in other parts of the world they call it Tylenol, and all those kind of medications, and also opioid medications like oxycodone and stuff like that. But then any of this medication you're taking, you are supposed to make sure is monitored and managed so that the side effect doesn't go way out of proportion. What I'm going to say is this: any medicine you take, any medicine at all you take to help you resolve pain, resolve fever, resolve anything in your body is going to have some kind of side effect. The thing is that in some people is mild and in some people is extreme, but make sure any medicine you take, it is monitored by a physician. You don't just take medication over the counter just because of this side effects or outside effects. For more tips, you can like, share, and follow us on this channel, and we promise to bring you more information about medications. Thank you and have a good day.